I mentioned a bit about the 3D scan or a digital scan or a graphic map of your teeth. It's really what we call CAD CAM. It is not new in dentistry. It's been around for easily a decade. Ultimately, it's using a device that's custom for dentists to use. It's like a little in the mouth camera, if you will. Slightly bigger than the ball pen, obviously, but essentially takes pictures. Some takes a live video, and then we stitch it all together to form a digital file of your teeth. And that way we can essentially, like with most things digital and graphic, we can then almost like an open source, open world way of modifying and designing and looking after your teeth in that sense. Yeah, I think dentistry is evolving all the time. I think most professions should be moving forwards one way or another, and dentistry is no different. In terms of dentistry moving forwards, digital dentistry is such a trendy word. It's come to the fore play of what we do, especially on the back of COVID, when human contact has to be kept to a minimum. So I think that's where it became really relevant into the mainstream media, if you will, of dentistry. But I think we have to kind of accept that it's not new. Maybe in the UK, there has been traditionally a little bit more resistance to these kind of things, but it can only assist the clinician, the day-to-day clinician, implement the kind of care at the level that we want to implement it for our patients. And for me personally, I cannot live without using one form of digital dentistry or another, whether it's communicating with my dental lab technician, who are people who design in collaboration with the clinician your crowns, your bridges, your veneers, your even to an extent your dentures. It opens up lots of possibilities. Perhaps one of the more relatable things for patients is all the pink gloopy stuff that we tend to use for your molds. It's now replaced by something that doesn't involve being so invasive in the mouth. So I think that's where really digital dentistry is the advantages. I must stress as well with the kind of background that I have, it's a bit like driving a manual car. You can't really say that digital dentistry is the holy grail to every kind of dental problem. It's definitely not the only solution or the only way forwards. It certainly adds to your armamentarium as a clinician. And I cannot emphasize enough, I think analog way, you still have to know it really well so that you can troubleshoot with all the digital kind of hiccups when it does happen, because it will happen at some stage.